First of all, I'm the nurse in the emergency and then the sickle cell patient was brought to me. First of all, I'll ask the patient, are you our patient in this particular hospital? If the patient answers yes, I'll then request for the patient's hand card to get the folder. If the patient said no, he's not our patient, anybody can come to the emergency, not necessarily the patient of a particular hospital. So if the patient said no, what next I need to do is, sorry, I'm talking as a staff of a teaching hospital. I've not worked in other specialist hospital or thereabout to know their protocols. But the protocols I know that work for us in the teaching hospitals, the two teaching hospitals I've worked, is that in a teaching hospital, when a patient comes, you make the patient comfortable on a couch in an emergency room. Then you look for the doctor of that patient. Or there is a casualty officer. There's somehow you go to emergency, you don't see the doctor. There is a casualty officer. His work or her work is to be in the emergency, so that if there's any patient, it's the casualty officer that will clerk the patient and then know which team or which unit they're going to refer the patient to. So as I'm calling the casualty officer, this patient is complaining to me, let me use pentazocine. Give me pentazocine. As the casualty officer is coming, if I don't want to give the pentazocine, since in a teaching hospital, it's the doctor that will need to prescribe drug for the patient first before I administer. What I need to tell the patient is, please calm down. Let the doctor see you first. We're going to administer whatever drugs the doctor prescribed for you. Meanwhile, since the patient is on crisis, we'll set up infusion so that at least the pain will reduce a bit, depending on when the doctor will prescribe the drug. And as we are setting it, we'll make sure that the doctor is around, clerking the patient, so that he will prescribe the drug. Immediately he finishes prescribing the drug, if it is the one that the patient is using, fine and good, we'll get it in the pharmacy and administer. If it is not the one, it's very simple. My sister, these are the drugs that the doctor prescribed for you. Sorry, you said penta one, but you've been using. But this time around, the doctor will prescribe morphine for you. So the doctor has prescribed morphine. We're going to work with the morphine. Maybe subsequently, when you get stable, you can talk to the doctor. And he has his reason for prescribing this. Because I'm sure the doctor too will have to clerk the patient, ask the patient question. First, are you taking any analgesic? Which analgesic have you been taking? It's now his decision to check which drug is going to prescribe for the patient. And as he prescribe it, it's now left for me to administer the drugs. But let's say in a situation whereby I'm not in the teaching hospital, where their protocol is different. I'm working in a general hospital, whereby a patient is being brought to the emergency room, and then there's no doctor around. I'm the nurse. I'm not supposed to wait for any doctor to come. I will have to, first of all, assess the level of the pain. If it is the one that I can give PCM, fine and good. If it is the one I can give penta, fine and good. If it is the one I will give morphine, fine and good. But first of all, before even administering, I have to ask the patient, do you react to this? Because there are drugs that patients react to. So that I won't complicate the issue instead of trying to help. Because most of the times we don't ask patients whether they react to drugs, just administer drugs to them. And it's wrong. For example, when I had my CS, they prescribed penta for me. So the first day they gave me the penta, I vomited. So my niece was around. So my cousin was around. When I vomited, she was like, maybe it's the effect of anesthesia. And I told her no. I said, let's wait and see. After a while, he came back and administered that round of penta. And I vomited. So I now asked the nurse, which drug did you administer? She told me penta. I said, please don't give me that again. She said, why? I said, I discovered that this is the second time you're administering this drug because it was immediately she administered the drug, I vomited. That means I'm reacting to that drug. So even the following day when the doctor came around and I told him, he said, did you tell the nurses? I said, yes. So he asked them to discontinue the penta and give me PCM. So also, there are some sickle cell patients that abuse drug and then penta has become like normal PCM to them. There are some patients that when you give them PCM as if you are not giving them anything. So when you give them penta, they are okay. But there are some sickle cell patients that if you like give them 10 doses of penta, they will not feel anything. They've abused it. They are so addicted to it that they feel it's now part of their body system that they feel this thing is not doing again. So you will now move a step further. Maybe let's give this patient morphine and see if the pain will reduce. And then as you give, you document so that the next person coming will know this is what you administer to the patient. But in a situation whereby the patient say maybe he's a PHC and the patient comes and he say, please give me penta, and that's the only drug you have. Would like to say because the patient told me what to do, that's why I'm doing it. No, I'm doing it to help the patient, not that patient is dictating what he wants. Because most of the times nurses feel the patient are dictating to them what they want. They say, why are you the one to tell me show me my work? No, they are just trying to tell you that this is what I'm used to taking. If they keep quiet, it's not left for you to decide. Or if they tell you, it's still left for you, okay, should I give this one or I should wait and give a different drug? It affects both parties, both negatively and positively. Okay, the positive aspect is that since the patient native told me that my sister reacts to that food because she has ulcer, what I will need to do is I will ask her, how do you know she has ulcer? It's just simple things, simple 1, 2, 3 put together. How does she react to it? There are people that when you give them diclofenac, they vomit blood. I've seen several patients. They vomit blood, or immediately you give them the circumference of chest pain or abdominal pain. Then you should know that the patient native is telling you the truth. So don't even think of administering the diclofenac. Rather, go for another different one that you can administer. Because at least you've learned something. That's why it's a positive. As a nurse, she has learned something that this particular patient reacts to diclofenac. I won't think of giving. I will document it. Patient native says patient react to diclofenac. So that when I'm handing over, I'm not around, the next nurse that will take over and will see it and not to think of administering it, because this is what the patient native said. And then if I go ahead and give, the patient will suffer it. And that's the negative aspect towards the patient side. Why should I complicate issue instead of trying to assist or instead of trying to help the patient to recover? I'm supposed to listen to whatever the patient will tell me. That's why I said earlier that I always tell my friends when we're in school, I'll tell them, if the patient say I want to see you, even if it is for 5 hours, sit with that patient and hear what the patient will see. The patient will teach you a lot of things. But the fact that I went to school and studied nursing, it doesn't mean I know everything. There are some experiences that we learn from the patient. Like the patient that will tell you, I don't take this because if I take it, I react to it. Don't give. Once you tell me you react to this, I don't even need to force myself to give you or argue with you. It's very simple. I won't give. Because if I give, I'm putting myself in trouble. Because if anything happens to that patient, they will hold me responsible. Because already the relative said that the patient reacted to this. So I'm not supposed to give. Most of the times, when the patient relative said the patient reacted to this drug, start shouting, are you teaching me my work? Do Do you know how long I've been doing this nursing work? For the past 20 years, I've been doing this nursing work. You just come today and start telling me, commanding me up and down. Yes, it's the patient's body. The patient has right to do whatever. That's why we have patient's rights. And it's because patients don't know their right, that's why they take anything from nurse. I always tell people, I say it's in this part of the world that patients don't know their rights. The nurse will tell you rubbish, you sit down and look at her. The nurse will look at you, will do anyhow with you, you look at her. I'm not saying that a patient has the right to tell to look down on the nurse or insult the nurse because the patient has right. No. We should work as a team. Without the patient, if I come to work, what will I do? I'll just sit down like this and be looking and be watching time. Once it's 2 p.m., I'll take my bag and go home. Or if there is patient, I'll work. That's why I'm there. I'm there for the patient. So we have to work together in synergy. You are my patient, I'm your nurse. If I have any issue, patient, this, the patient will tell me. If the patient has any issue, call me, nurse, I will come. What is it? This. Please give me this, give me that. If I won't give the patient this, I will tell you, sorry, I can't give you this. This is the reason why I won't give you. Not that, no, it's not like that. We're not supposed to do what other stuff like that. No. In everything you are doing to the patient, you're supposed to explain. Everything a nurse is doing to a patient, the patient is supposed to ask the nurse, why are you doing this to me? Why are you giving me this particular drug? The the nurse supposed to know the reason why she's administering this drug for you. Why are you giving me penta? I will tell the patient I'm giving you penta because of your pains. I want to relieve the pains. But if you opt out, you said you don't want it, fine, I won't give you.